What needs to be very relevant is if we want to control costs, because we are discussing various things including price control, are we ensuring that the incidence of taxation has not increased over what it was? Because otherwise that will be very unfortunate.
Internationally, it is about 5% or 7% in most part of the world. Only here in the products that we market, we have to pay 18%. That creates a major problem for even small and medium scale industry.
The GST impact has increased the overall dialysis costing by about 7.5%. Healthcare services being exempt from GST doesn't mean that the service providers are able to be exempted fully.
Government should have looked at reducing the GST rate. It should have been 0, but right now currently it's at 12%. Some of the products even at 28%. If not 0, should have been like at least like 5%.
My own view on this and my own appeal to the government of India would be that till India reaches a certain level of penetration, keep GST on health insurance at a minimum level, example 5%.
It is the ideal way to consolidate different tax levels at different states, and one GST will take care of the total regulatory requirements of revenue.
It will, rather than increasing ease of doing business, it will reduce ease of doing business, and collections also we do not know how much the government will be able to benefit if it becomes a very difficult law to implement. And there should be no changing of stances after you have carefully thought things. The people who are having a turnover of less than 20 lakhs, they should not be brought in under GST if you have already said that they will not be brought in. So you cannot be sashaying. You have to be, once you have taken a decision after careful consideration, you have to stay firm on it.
If I was to look at overall in the healthcare continuum, it actually raises the price of healthcare because the end user of medical equipment happens to be a hospital, and a hospital is unable to levy GST. So when they are not able to levy GST, they are unable to take input credit, and this pretty much has to be then recovered from the patient.